I'm washing my hands. Hello, my name is Zach Fryer. I'm a student PTA of Penn State Hazleton. Is it okay if I be working with you today?
Yes.
Can you please tell me your name and date of birth?
Bobby Schaefer, April 7, 2005.
Do you know where you're at today?
Penn State Hazleton.
And what's the year?
2025.
Alright, so today we're going to be doing some exercises to help facilitate and help out with some of your activities during your daily life.
Okay.
They're called PNF and NDTs.
Okay.
Well, I'll kind of talk about that more as we move on. A couple of things before we start is that I have a second person here to help me out. You just can't see them. During this treatment, you may feel fatigued, you might feel a little bit of discomfort in your left side, you might feel a little bit frustrated, that's all right. And the big thing is we're looking for no pain. So if you feel pain at home when you're doing your home exercise program, or if you're feeling pain during our exercises today, I want you to let me know and we'll stop activity. And another thing is, you might have a little bit of loss of balance. That's what this is for. This is called a gait belt. This is just so that I grab onto the belt instead of grabbing onto your limbs or clothing. It helps me out and it'll help you out. So like I said, when you're doing these activities, you should feel no pain at home. You should have 2 people assist you at all times. And the treatment that we're going to be doing today will be your home exercise program, so I really want you to try and pay attention so that you know what you're doing. All right, now I'm just gonna apply the gait belt real quick, so if you could just bridge up for me. And I want this to be snug, but not that it's cutting off. Is that tight enough?
Yeah, feels good.
All right. So, a couple questions before we begin. Do you have any pain today? On a scale of 0 to 10, what would you say your pain's at?
Like a 3.
Like a 3? Can you point to me where that pain's at?
Yeah, it's just like kind of my leg, like thigh.
Yeah, like right here?
Yeah, just kind of throughout the leg.
All right, I got you. Do you have any activities in your daily life that this is affecting? I saw in your chart that it's hard to put on pants.
Yeah, putting on pants has been real difficult.
All right. What would you say your prior level of function was?
I was completely like independent and on my own.
Yeah, I got you. And do you have any goals to get out of PT?
Just to become as functionally independent as possible.
That's fair. Did you work before this injury?
Yeah, I was working at CVS just
okay.
as a pharmacy tech.
Do you plan on going back?
Yeah.
All right. So we'll try and make sure we do some functional goals to get back. I'm just going to do a quick skin inspection. Now my patient would be wearing shorts, but since he's wearing pants, his skin is intact. I would take off the sock and the shoe to check the foot. I am going to take off the shoe. Skin is good. All right. Now what we're going to do is we're going to do a quick goniometric measurement. And I want you to do me a favor and roll towards me. We're going to put you down, laying face down on your tummy.
Yep.
And then we're going to measure your left hip extension.
Okay.
So go ahead and roll towards me. All right. No pain with that, right?
Nope.
All right. Now I'm just going to feel around for your greater trochanter. All right. My fulcrum's the greater trochanter. Proximal arm is in line with the pelvis midline, and my distal arm is in line with the lateral condyle. Now, before we begin, can you just show me your motion of lifting your foot off the table with a straight leg? Good. All right, now I'm going to measure it this time, so try and hold it at the top for just a couple seconds. Go ahead. All right. You got a solid 14. Normal is 20.
Right on.
That's all right though, that's what we're here for. We're gonna work on that. All right, I'm just gonna come over to this side and we're gonna do some PNF patterns. So what you can do is roll towards me again. You can use your good side to push off as much as possible. All right, now what we're gonna be doing is a PNF pattern. What this uses is we're gonna be doing a diagonal pattern with your leg. I'll show you kind of how it goes. So what we're going to be doing is we're going to be putting our legs straight off the table and we're going to be pointing our toes down. and then we're gonna be coming up and in, and our toes are gonna come up as well. So it's down and out to up and in.
Okay.
All right. So I'll kind of take you through that motion real quick, and then we'll be adding different kinds of facilitatory techniques throughout the treatment.
Cool.
But if you want to shift towards me just a little bit to make sure your legs off the table. So we're down, and what we're gonna do is we're gonna come up and in like that, and then our toes are also coming up when we're doing that.
Cool.
And now you can put your toes down, and we're going down and out.
Okay.
All right?
Cool.
We did that 5 times. All right, so we just did some rhythmic initiation. That's the passive movement that we just did. So the next step that we're gonna do is we're gonna do 1 set of 10. What I'm gonna be adding is when we're off the table, I'm gonna be doing a quick stretch down at the bottom and a quick stretch up.
Okay.
And what that does is it stretches the muscles that need to be activated when you go down and up, and it allows you to facilitate the muscles for re-education.
Sure.
All right, so now I want you to activate the muscles on your own.
Okay.
And we're gonna be going through it, but I'm gonna add that stretch. I'm gonna be having my hands on the inside when you're going up and in, and I'm gonna switch my hands over after the quick stretch, and when we go down and out, okay?
Sure.
All right, so we're pointing our toes down. I'm quick stretching down. We're going up and in, okay? And now I'm switching my hands, quick stretch, down and out.
Okay.
Got it?
Yep.
All right, so that was 10 reps. All right, so keep your leg on the table.
Oh, sorry.
You're good. And what we're gonna do now is we're gonna do our full sets of our PNF patterns. Before we start that, did you feel any pain with that movement?
Nope.
How are you feeling? Are you fatigued at all?
No, I
Anything
feel
like
good.
that? Feeling good?
Yeah, I feel
all right. So now's where it might start to get challenging because at the top I'm going to be adding 3 pushes or 3 pulls, and then at the bottom I'm going to be adding 3 pushes.
Gotcha.
So it's going to be at the end of the motion, and then we'll keep doing the quick stretches, and we'll continue doing the PNF patterns, 3 sets of 10.
Gotcha.
Remember, any pain, please let me know. And are you ready?
Yes.
All right. So, quick stretch down. We're going up. 1, 2, 3. All right.
Okay.
Switching my hands. Quick stretch down. 1, 2, 3.
Gotcha.
All right. We'll do that a couple more times.
Okay.
Now, I only do the quick stretch on the first rep. So now it's just the pushes and pulls.
Right.
So toes up and in. And we're up. 1, 2, 3. Toes down and out. 1, 2, 3. Up and in. 1, 2, 3. Down and out. 1, 2, 3. And that would be 10 reps. All right, how are you feeling?
Good.
All right, so I'm just going to lower the table now as we head into our next portion. And like I said, that pattern right there, that's gonna be your home exercise program. So when you're at home, you can do those diagonal patterns on your own. I would have someone watching you just for safety purposes. And I'm gonna put your shoe back on before we do the next portion of this. Is that comfortable?
Yes. Thank you.
All right. All right, so now we're gonna be doing a sit to stand transfer. So, all right. So we're gonna be sitting you up. I'm gonna be holding on to your gait belt. So if you want to go ahead for me and swing your legs off the table, make sure that your feet are on the ground. If not, I can lower the table.
Yep. All right.
Now I am grabbing that gait belt because I'm going to be pushing down on your pelvis when we stand up and as we go back to sit down. I'm doing that to facilitate the movement and make sure that you're not off balance. If you are, I will catch you. That's what the gait belt's for. I'm gonna have my other hand on your foot, pushing down and kind of facilitating the fact that we're putting weight on this left side.
Okay.
So when we do this, I'm gonna be standing you up, pulling you towards me so that we really get the weight on the left side. And then I'm gonna push down and block your knee, and then we're gonna sit down. We're gonna do it twice, all right?
All right.
So whenever you're ready, I'm gonna lean you forward.
Okay.
You're gonna push off with your good extremities. I'm gonna pull you towards me.
Okay.
Ready? 1, 2, 3. I'm blocking the knee. Now I'm gonna lean you forward and go ahead and sit down. All right, we're gonna do that one more time.
All right.
Ready? 3, 2, 1. Still blocking the knee. And lean you forward and sit down. How'd that feel?
Good.
All right, now you can go ahead and put your legs back up on the table. All right. Now, just a couple post-assessment things. How's your pain now?
Good.
Good?
Yeah.
What would you say it's at?
Like a 1 out of 10 decrease.
Would you say it's still on that left side?
Yeah,
The
it's
same
in like
area?
the leg, yeah.
All right. Skin is still intact. I would take the shoe and the sock off again. My patient would still be wearing shorts. And we're just gonna re-observe your range of motion one more time. So we're gonna do that same roll we did before. So go ahead and roll towards me. All right, show me that lifting your foot off the table one more time. Good, how'd that feel?
Good.
All right, now you can roll towards me the last time. All right. Now, like I said, for home exercise program, make sure you have 2 people around at all times, or at least 1 person while you're doing the diagonal patterns. Note, you should feel no pain during the home exercise program. If you do, come into the next treatment and please let me know and we'll kind of reassess.
Okay.
So, like I said, the PNF is the diagonal patterns. You're gonna be doing that same pattern, 3 sets of 10, once a day,
Okay.
every day.
Okay.
And for the NDT, anytime you decide to do any sit-to-stands, make sure you have 2 people around you. I'll try and train someone at home and make sure that they do the same pulls and pushes that I was doing. You'll perform the NDTs, like I said, anytime you do a sit-to-stand.
Okay.
And do you have any questions for me?
No.
All right, thank you for letting me work with you.
Thank you.